Colics in newborn babies, signs and symptoms, causes, and home remedies. Colic is commonly described as a behavioral syndrome in neonates and infants that is characterized by excessive, paroxysmal crying. Colic is most likely to occur in the evenings, and it occurs without any identifiable cause. It is also common during the first 3 months of life and tends to disappear by 4 months of life. Colics are benign and self-limiting condition. Signs and symptoms. Timing of crying. Crying by infants with or without colic is mostly observed during evening hours and peaks at the age of 6 weeks. Amount of crying. The amount of crying is not related to an infant's sex, the mother's parity, or the parent's socioeconomic status, education, or ages. Characteristics of crying. Compared with regular crying, colicky crying is more turbulent or dysphonic and has a higher pitch. Family's daily routine. Possible other causes of excessive crying, e.g., having hair in the eye, strangulated hernia, otitis, sepsis. Colic remains a diagnosis of exclusion. Examination findings. Normal physical findings. The baby is normally healthy. Weight gain. Infants with colic often have accelerated growth. Failure to thrive should make one suspicious about the diagnosis of colic. Exclusion of potentially serious diagnoses that may be causing the crying. Possible causes of colics in babies. GI causes, e.g., gastroesophageal reflux disease, GERD, over or underfeeding, milk protein allergy, early introduction of solids. Inexperienced parents, controversial, or incomplete or no burping after feeding. Exposure to cigarette smoke and its metabolites. Food allergy. Low birth weight. Characteristic intestinal microflora. Management of colics in babies. Rule out common causes of crying. Recommend that the parents not exhaust themselves, and encourage them to consider leaving their baby with other caretakers for short respites. Drug treatment generally has no place in the management of colic unless GERD appears likely, although the anticholinergic agent dicyclomine hydrochloride is effective against colic. It has rare but serious adverse effects and cannot be recommended. Consistent follow-up and a sympathetic physician are the cornerstones of management. Various benign but unproven treatment modalities are available, including the following. Maternal low-allergen diet, low in dairy, soy, egg, peanut, wheat, shellfish, may offer relief from excessive crying in some infants. Lactobacillus reuteri. Simethicone. Oral hypertonic glucose. Spinal manipulation, to recommended with caution, if at all. Behavioral management. Nutritional supplements and other complementary medicines. Elimination of cow's milk protein in cases of suspected intolerance of the protein. In infants with suspected cow's milk allergy, CMA, a protein hydrolysate formula is indicated. Uncommonly, amino acid-based formulas may be needed to manage suspected CMA, though evidence may be lacking for use in colic. Soy-based formulas are not recommended, because many infants who are allergic to cow's milk protein may also become intolerant of soy protein.